Namaste. My name is Chandra-Mouli. After a 30-year-long career with the World Health Organization, I continue to work on adolescent sexual and reproductive health and rights independently, selectively, and without remuneration. I invite you to join me for a short presentation on taking evidence to action in adolescent health. The May 2026 issue of the Journal of Adolescent Health carries an editorial by Tor Berg and myself titled Translating JAH Science. It announces the launch of a letter to the editor forum for people to share their experiences in using science, evidence from research studies, evaluation, documentation of case studies, and reviews published in the Journal of Adolescent Health to inform laws and policies, strategies and plans, and programs on adolescent health. It contains 5 points. Over the last several decades, the body of evidence published in the Journal of Adolescent Health and other publications have shown that adolescence is a special phase in an individual's life course, and that investment in adolescent health through evidence-based interventions can promote health, prevent health problems, and effectively respond to them if and when they occur. This evidence has contributed to measurable improvements in some areas of adolescent health. Sadly, this progress is now under threat because of unprecedented changes in the global context. 3 points on this. Norms, practices, mechanisms, and institutions that have spearheaded progress on adolescent health have been challenged or dismantled. Abilities of international organizations to deliver on their mandates has been undermined, and resources have been hugely constrained. Experience has repeatedly shown that high-quality evidence is essential, but that without deliberate strategies to support their use, research findings do not automatically translate into policies and programmatic change. They remain in academic circles, making the rounds. They may be selectively interpreted and taken, or they may be dismissed altogether. This is true for all areas of evidence, but the distance between evidence and action in adolescent health is especially wide, as I will describe in a few minutes. 3 sets of factors make it particularly difficult to translate evidence to action in adolescent health. Firstly, the evidence to action journey confronts legal barriers and has to deal with social sensitivities. Secondly, there is limited expertise in adolescent health in many governments. There's no career pathway for people with adolescent health in government, unlike, for example, in child health. And the relationship between governments and non-government organizations, NGOs, which have more experience in this area because of their long-standing involvement and their connection with global networks, is often tenuous or tense. Thirdly, international organization staff may themselves not be abreast with the latest evidence. Not all of them, but clearly a non-negligible proportion. So to sum up, lots of challenges, particularly in the field of adolescent health. Moving from publishing a paper in a journal to seeing its conclusions and recommendations applied to achieve impact requires structured engagement, convening policymakers, programmers, advocates, and adolescents themselves to interrogate, contextualize, adapt, and interpret evidence for real-world use in different contexts. Evidence translation, then, is much less about dissemination and much more about fostering dialogue and joint decision-making to chart out pathways of action informed by local realities and local wisdom. The Journal of Adolescent Health has taken up the challenge of fostering scholarship in the uptake, implementation, and achievement of impact. It wants to contribute to evidence being actively shared, discussed, debated, questioned, and then acted upon, not just published and archived. It wants researchers who publish their studies, evaluations, case study documentation, and reviews in the JAH to play a more active role in supporting the application of the evidence that they themselves have helped generate. And it's providing them with a forum to share their experiences, both positive and negative, with others. I'd like to move on to a few other issues. In many cases, a research study, an evaluation, or a review is in response to a clear ask, for example, from a gap identification or a priority identification exercise. So there are stakeholders who are waiting for the evidence, who grab the evidence as soon as it is generated and seek to apply it. But that is not always the case. The expected users of the evidence may not have been involved or may have been only nominally involved in defining the evidence gap, doing the evidence generation and formulating the conclusions and recommendations. And then one day from the blue, they get a set of recommendations which they are told is very important to apply from today. Sadly, from what I hear from many colleagues and collaborators, that is not the exception. Whatever the situation, generating the evidence, writing it up for publication, and then walking away is, I believe, an abdication of a responsibility. And going a half step further to prepare a flyer and doing a dissemination event is not very much better. The same level of enthusiasm and effort that went into, say, designing and executing a multi-country implementation research study must go into identifying evidence-based approaches to take the evidence generated and to support its application. Many researchers I've discussed say that they have neither the expertise nor the resources to do any serious dissemination. Some of them say that this is not for them to do. Other researchers, especially but not only in low-income countries, say that they find it easier to present their research findings in offices and conferences in Geneva, London, or Stockholm, rather than in their own capital cities. They find it hard to engage decision makers unless a study is very high profile, is highly resourced, and has international partners. The financial crisis that we have today is a real opportunity to change the status quo and get national and subnational decision makers to respect, value, and use locally generated evidence. I'd like to move on to one concrete example of a well-resourced, well-thought-through initiative to bridge the evidence to action gap in adolescent sexual and reproductive health. CRANK, the Child Marriage Research to Action Network is a global knowledge sharing and knowledge coordination platform managed by Girls Not Brides, a global partnership to drive change and empower girls. It is supported by the UNICEF UNFPA global program to end child marriage. CRANK brings together researchers, practitioners, advocates, policymakers, and funders to strengthen the global response to end child marriage through evidence-based action. It holds regular online meetings on the latest child marriage evidence and practices, maintains an extensive database of ongoing and completed research studies, and provides members who don't want to plow through all the publications with ready-to-use research syntheses and summaries. CRANK is not the only platform trying to do this. On this slide, you see that I have listed 3 other platforms. One, the UNESCO UNFPA Global Partnership Forum on Comprehensive Sexuality Education. 2, FP 2030, the global partnership dedicated to using family planning to advance global health, support gender equality, and develop thriving communities. And the Asia Safe Abortion Partnership, a regional network to advance women's sexual and reproductive health by promoting access to safe, legal abortion in Asia. In countless events, I have seen individual researchers given a platform to share their findings, to explain their findings, and to have an opportunity to connect with people who are interested in their findings and ready to support them to apply them. To conclude, concerted efforts to take evidence to action are more important today than ever before because of funding cuts, the attacks on science, and the pushback on sexual and reproductive health and rights. I invite you to take up the Journal of Adolescent Health's invitation to share what you, your colleagues, and collaborators have done to take evidence to action. I also hope that this initiative will inspire and energize you to do just a little bit more than you have been doing in this area. My takeaway message is that sound evidence is essential for adolescent health. But it is only through intentional transfer, grounded in dialogue, partnership, and an understanding of power and context that it can improve adolescents' lives. Thank you and namaste.